Are you looking for ways to prevent swine flu? One of the most important things that help reduce the spread of epidemics is knowledge of prevention methods and adherence to them. Here are the ways to prevent swine flu and everything that may concern you. While swine flu isn't as scary as it seemed a few years ago, it's still important to know how to prevent flu to avoid getting it, as it can cause more serious health problems for some people. There are antiviral medicines that can be taken to prevent or treat swine flu, and these medicines work to make you feel better. It is preferable to take the medicines within 48 hours of symptoms appearing. A swine flu vaccine is also available in the form of an injection or a nasal spray that stimulates the immune system to attack the real virus. Besides the vaccine, there are a group of prevention methods that work to prevent the spread of germs that cause respiratory diseases, such as swine flu, and these methods include the following. 1. Maintain personal hygiene. One of the most important ways to prevent any kind of epidemic is to maintain personal hygiene by continuing to sterilize and change clothes after returning home. 2. Wash hands frequently. The Centers for Communicable Disease Control recommends practicing good hand washing with soap, ensuring proper hand washing, and washing hands after coughing or sneezing. 3. Avoid contact with infected people. Dealing with people with swine flu should be avoided, dealing with caution in public places, wearing a mask, not touching surfaces, and not being in crowded places during the spread of the pandemic. 4. Use tissue paper. One of the most important things that contribute to limiting the spread and infection of swine flu is the commitment to cover the nose and mouth when sneezing and coughing with a tissue in order not to spread the spray on surfaces and to ensure that the tissue is disposed of in the trash. 5. Avoid handling or touching pigs. Pigs and animals are the vectors for infection, and during the spread of the pandemic all over the world, a set of recommendations were made to avoid being in pig pens and farms and not to come into contact with pigs that show abnormal signs and symptoms, and a commitment to wear personal protective equipment such as clothes, gloves and masks that cover the nose and mouth when needed. 6. Avoid touching the face. During the spread of epidemics, attention should be paid to not touching the nose, mouth and eyes, sterilization, good hand washing, and then washing the face as well, because one of the means of transmission of infection is contact with infected droplets and its transmission through surfaces. 7. Commitment to the quarantine period. One of the most important ways to prevent swine flu is quarantine, as the infected person must spend the infection period at home and not mix with other people for a period of 7 days after confirming the infection, to limit the spread and transmission of infection to other people. Swine flu must be prevented because it may result in many complications, such as difficulty breathing due to respiratory problems, lung infections, unexplained bouts of nervousness, tension and confusion, exacerbation of chronic conditions in patients with heart and asthma. People at risk of swine flu. There is a group of people who are at high risk of complications from swine flu, who must apply and adhere to prevention methods, including people over 65 years old, children under 5 years old, patients with diabetes mellitus, HIV and cancer patients, pregnant women, people with chronic lung disease, those with heart failure, people with a weakened immune system.